So
what do you reckon, Gary?
go for it.
Good to go.
Yeah, you're live now.
Excellent. Well, very good afternoon. Boa tarde for anyone joining us from Maputo or elsewhere in Mozambique. Very warm welcome to this special IDS seminar. My name is Alex Shankland. I'm a fellow in the Power and Popular Politics Research Cluster here at IDS. And today we're going to hear about a pioneering program engaging in creative ways with a challenging context, and particularly how the program has engaged with the political economy of a context characterized by closing civic space and increasing the authoritarian centralized regime and increasing the endemic political conflict. So before I introduce the panel of speakers, I'll actually introduce the person who's going to discuss it with us, because we're very happy to have rejoining us, former IDS fellow and IDS honorary fellow, right? Neil McCulloch, who is Executive Director of the Policy Practice, one of the leading centres for political economy practice and thinking in development. So we're delighted that Neil's agreed to join us in reflecting on what he's heard and what it might bring to broader conversations about thinking and working politically, and about engaging seriously with the complex politics of governance interventions in a fractious, fractured, conflict-prone and polarized planet. So we have a brilliant panel of speakers who have all been involved in the research that's going to be presented in different capacities. We also have another colleague who worked with us on the research. That's Kathy Shutt, who's an honorary associate with the Power and Popular Politics Cluster, also here at IDS, who is a leading monitoring, evaluation, and learning specialist who's been advising POTENCIAR and working with us on this study. We have to my left Karin. Karin Alexander is at the FHI 360. She is actually the Governance and Accountability Lead at FHI 360 UK. She's a political economy practitioner, an Africanist, an exponent of dialogue and transitional justice as routes to sustained political transition, and by origin a Zimbabwean, currently based in Cape Town. But we're very pleased that we were able to take opportunity of her visit to the FHI 360 office in London to get her down. FHI 360 is one of a consortium of organizations implementing POTENCIAR. The consortium is led by Kamarix International. We at IDS are the lead for the research, evidence, and learning component, and that is going to be represented in this panel by Ludo Alcorta, who's an IDS postdoctoral researcher based in Maputo. He's the research and evidence lead for POTENCIAR, and he's worked on conflict governance and development in sub-Saharan Africa for a decade. So Ludo is going to take us through the program, the context in which it emerged, how it's adapted, and its approach. Karin is going to take us through some of the political economy thinking that's gone into the analytical work that we've been doing on learning from the POTENCIAR model. Cecilia Robertson dos Santos, who is a social development and gender specialist and IDS alumna, there's a big IDS reunion today, has also worked as a consultant researcher on this study, and she led the case study. So that's what she's going to present as part of this overview of what we've learned from this research. And I think that's everyone. Great. So yes, so I'm delighted to invite Ludo to kick us off by explaining a bit about POTENCIAR. And I hope that in the question and answers, if you're on Zoom, colleagues, please feel free to post them in the chat or the Q&A, Gary.
Q&A.
In the Q&A. Please post comments and questions in the Q&A. We have Gary from IDS Comms here monitoring that, and we will be able to come to those questions, hopefully in about 40 minutes after the presentation, to give us 10 or 15 minutes before the customary 2 p.m. break for questions and comments from the room and from online. We will then run for a further 30 minutes with anyone who's able to stay from 2 to 2:30 GMT, which is, 4 to 4:30 Maputo time. So I will ask Ludo to run us through where the program came from, and then we'll run in the sequence through the presentation for about 40 minutes, and then we'll open it up. Thanks very much. Ludo, over to you. And the clicker stopped working here. Clicker stopped working.
You hear me?
Yeah.
Right. All right. Thank you and welcome from Maputo. I'll speak a little bit to the program design, how the program ultimately sort of came to be, and how it also evolved over its lifetime. We'll start with the business case way back in 2017. It was originally designed as a tacit program, transparency accountability program, and the business case reflected a number of the context at the time, which was the then state of transparency and accountability initiatives, which involved early efforts that focused on discrete technical projects, improving service delivery, but also faced criticisms for being decontextualized and failing to address systemic issues. It was subsequently developed initiatives incorporated political economy analyses and adaptive programming to tackle power dynamics and systemic changes. There were two different types of approaches to accountability mentioned in the business case. One was strategic rights-based approach, promoting a collective action, including marginalized groups, demanding accountability, and often through confrontational tactics like productive resistance and sandwich strategies. The second approach was a more pragmatic approach, which focused on collaborative problem solving, engaging diverse stakeholders without privileging per se particular groups or ideological stances, and often avoiding confrontation. And these debates are also mentioned or addressed in Florencia Gorsovic and Tom Aston's analysis in 2023. But yeah, so it also came off the back of various DFID Mozambique experiences, which were 4 discrete, successful democracy and accountability programs. And the business case addressed a particular need, a systemic need of extreme poverty, inequality, centralized budgets, and particularly weak accountability in service delivery. Finally, it also spoke to the potential for UK interests, which were gas and still are gas and coal reserves, potential information technology, and the ability to tap into the youth population, and the burgeoning population. The business case also had particular design features which involved multiple tactics, which involved inclusive coalitions, confrontational approaches. So these 2 approaches that I mentioned before. It had a focus on collaboration, so informed citizens and government officials and other groups that would be willing to engage and work together and support change. And it also had a strong focus on innovation through ICT, using particular technologies to facilitate monitoring, to facilitate visualization of data, generation of data, and decision making as well. Software such as FactTech. It was also designed to be on multiple levels. So this speaks to the vertical integration approach that Fox and Halloran mentioned cited in 2015. Going from the local level or the facility level, district level, all the way up to the provincial and national level. So trying to sort of scale up initiatives across the different administrative levels. And it also focused a lot on the thinking and working politically approach, as well as an adaptive management approach. Using political economy analyses, log frame indicators that specifically focused on measuring learning and adaptation, were less say, conventional indicators. So trying to sort of see how it could adapt over time, fail fast, and pick up on successful initiatives. Finally, the design of the program focused very strongly on a brokering and convening approach, which was a donor funded with which focused on not necessarily financing every single activity, but more rather financing reunions and trying to get people at the table, and then allowing for sort of a co-financing approach. So minimal funding, which was quite unusual in the context where a lot of activities would be sponsored in this context. Next slide, please. As you saw, the business case was in 2017. However, it took the start of the program was delayed for a number of factors. Over that period of time, but already in 2017, civic spaces started to close with the situation of the debt crisis and fuel price protests. It created for quite a difficult or challenging environment. There were also increases in human rights abuses with the disappearance of journalists, and also the outbreak of armed conflict in gas-rich Cabo Delgado province. Furthermore, there was a funding squeeze during that period, which intensified competition among civil society and led to a certain protagonism for sort of competition for who would be able to get the diminishing resources. There was also severe deterioration during the 2020 and 2021 COVID lockdowns, where there was a narrowing of the civic space. However, at the same time, there was also some government openness to collaboration with civil societies on things like emergency relief activities. So it was a bit of a mixed bag there. There was also changes in UK aid policy. The tender was issued in 2020, January 2020, and won by a consortium by Chemonics, SASC-IDS, now FHA 360, and others. But it was delayed because of the pandemic and a number of other factors. So ultimately, it was confirmed in August 2020, but the inception phase only ended in March 2021. So it was quite a delayed start. These major UK aid cuts that were announced during the inception phase led to a redesign of the program. In addition, the Ukraine crisis put additional pressure on the aid budget from 2022, and so there were further rounds of cuts. So it led for quite a volatile funding environment. So all these contextual factors had quite an effect on program implementation, and it meant that the program had to be redesigned and refitted to focus more clearly on facilitation rather than grant making, by, for example, removing the innovation challenge fund component. It had to be pulled back from the demand side, citizen voice activities, by limiting the scope to work directly with social movements and grassroots groups. We also had to shrink the size of the PMU team. We lost comms and technical specialist capacity, and it increased management load on research and evidence functions. There was a greater focus on evidence and analytical work to identify low cost and high return pathways to impact. For example, we have to take the decision to concentrate specifically on the health sector in Nampula province, whereas the program was initially designed to only be piloting in the health sector and eventually scale out to other sectors. And finally, there was also a strong shift towards a more collaborative social learning approach, and not necessarily competing with other programs for visibility and protagonism. Yeah, let's see, we move on to the next slide. Yeah, so this is what the program ultimately ended up looking like. You'll see the program model on the left, and sort of the process of how we try to scale up on the right. The focus of the program ultimately became to sort of improve or to humanize healthcare in Mozambique. That was sort of the ultimate goal. With humanization, or with humanized health service delivery, what we mean is an ethical commitment to treat the patient with respect and dignity and consider them as a whole person rather than just a collection of symptoms. It was a way for the program to improve the quality of healthcare and strengthen trust between patients, caregivers, in a sense, sort of improving governance within the health sector. The program had 3 different pillars or components. This included empowerment, which was very much focused at the local level, health facility level. Collaboration, which was in between the sort of district and provincial levels in Nampula. And finally, policy influence, which was geared towards the national level and came into focus more at the end of the program. So with the idea of empowered service providers being able to hold each other accountable and benefit from the provision of health services, the focus on collaboration was to improve collaboration and coordination amongst key actors in order to leverage resources for improved health service delivery. And the focus on policy influence was, going back to the vertical integration point, to improve policy and advocacy initiatives that could contribute to sort of, reform laws and policies that would lead to humanized health services. We started with empowerment initiatives. We started with at the local level, and the initial phase was very much reliant on research. My predecessor, Katia Taela, conducted a very extensive ethnographic research on GRNs in Nampula and Manapa districts. And this identified issues such as prevalence of illicit payments, weak GRN processes, and the need for strong collaboration between state actors and civil society organizations as key issues, among others. POTENCIAR's interventions in the empowerment pillar subsequently focused on strengthening the capacity of service providers and co-management committees, which are kind of local community level committees that sort of form the liaison between the health facilities and the community to improve or to humanize health service delivery at the facility level. And we also supported the work of the health inspection service. The actors began to communicate more frequently with each other about complaints registered and GRN processes. At the same time, POTENCIAR recognized that in order to consolidate its gains at the facility level, it needed to complement its efforts by promoting holistic, harmonized, inclusive, and intersectoral health budget and planning process, both at the district and the provincial levels in Nampula. So it did this by providing technical and financial support for cyclical planning and monitoring meetings, and applying a brokering and convening approach, which created a space for civil society and marginalized groups to participate and voice their opinions, And it also stimulated collaborative decision-making. In the final phase of the program, POTENCIAR aimed to establish a lasting legacy through vertical integration of its collaborative initiatives at the national level, also using an evidence-based approach. So the program had already created the Humanism Most campaign to bring the lessons learned at the local level, excuse me, to raise awareness of humanization in health service delivery at the national level. And this campaign evolved, and this ultimately culminated in the formalization and submission of a bill of law on humanized healthcare, or rather against obstetric violence. In the case of GRNs, the study that Katja had conducted found a demand for formally designed and executed channels for complaints across the health system. And so POTENCIAR saw this demand and sort of exploited it and used its brokering convening approach to facilitate the establishment of a national multi-sectoral GRM platform led by government and civil society actors. Yeah, so that's a little bit about the program. I'll stop there. If anybody has any questions, I'd be happy to answer them later on. But I'd like to pass the word to my colleague, Karin, who will speak a little bit more about rather the second pillar and how the collaborative approach that the program took. Thank you very much.
Thanks, Ludo. Yeah, so first thing first, I was going to say a GRM is a grievance redress mechanism. I think we forgot to explain that. So we were looking at how health users were able to submit grievances and whether or not those were tracked and addressed in the different contexts. But I'm going to talk a little bit about how we framed our approach to studying whether we were having any impact in terms of brokering and convening groups to drive them towards more mutually accountable practices. So in ways that were more transparent in delivering public services, and particularly in the health sector. So I've put all these ladders up because once we'd done our research and we sat together to figure out what we thought we were learning about collaboration and collaborative practices, we kept coming back to the idea of a ladder. And there's a ladder of participation, which some of you may know from your studies, but I've got a whole host of different ladders up here because often when we think about a ladder, we think about progression to a high point, right? We're trying to climb up a ladder. And so there is, at the top is the best place to be. But I think for us, and particularly what we learned in terms of the context of Mozambique, it's really important to think about ladders slightly differently. So a ladder that you might use, as in the Everest example, to cross a ravine. So to get across something, where, ladders are not always taking us up. They're just this aid on a journey that we're taking. And that'll bring us back to the snakes and ladders of the title a bit later on. But I just wanted to make sure that we think about it as ladders that we can build together. So there's collaboration. There's all of these humans making their own type of ladder. There are humans building a ladder together. Sometimes all you need is a two-step ladder to reach up and get something out of a higher shelf. And that's what you need. That's what you wanted to do. You don't want to climb up and touch the ceiling. So I'd just like you to hold that in your minds as we talk about our ladder. And then just to say that, from my perspective as a practitioner, political economy for me, we're always looking to unpack the arrangement of power in a context and the impact that has on the likelihood of change or the ways in which change can happen. So we're trying to understand some sort of very structural and foundational elements of what's happening in the context. And we need to understand the macro context for some of that and then bring ourselves down to how that changes at a regional level, in a health clinic, in a family. So we're trying to understand how all of those things come together. And I think in particular in POTENCIAR, sometimes people think about the thinking and working politically realm as quite focused on going with the grain and not always a lot of attention on marginalized groups. And partly a link to IDS, but also to myself, we really focused on what we called a PEPA approach, which was about power and political economy. And I do believe that if you're looking at an issue or you're thinking about what you should do as a program in order to support a nation to drive change or groups to drive change, the first question you always ask for me as a political economist is, will what we're doing lead to broader social inclusion? And if the answer is no, well, let's maybe find something else to do. Because even if what we would do is easy to do, it's not going to make the change that we do in the end want to support Mozambicans to see. So I start from a premise that people are incentivized to either drive change or keep things as they are. And in contexts like Mozambique, which are fairly authoritarian, the people with power tend to be incentivized to keep things as they are, so to maintain the status quo. And so what you're needing to do is try and ensure that other groups of people can change that. And so you focus on people and organizations, because people can and do change their behavior. And so we want to work out how to support them to do that. And because of that, I always like to focus on what's called the rules of the game in a political economy approach. So it's the way things are done, the way governments are chosen is another way to think about elections, right? It's a process. They're processes, they're mechanisms, they are the way that we do things. You may have a confrontational approach, you may have a collaborative approach. So we focus in on these rules of the game because they also shape what people can do. So depending on how political competition works in your context, you're able to run as the opposition in an election or not, or it's much harder to run as the opposition in an election. So the way things are done shape and constrain the agency of different actors. And if you're powerful, you have more agency in these spaces than those without power. And when things don't happen as we expect them to, it's because somebody's working very hard to make sure that things stay the way they are. So we're always looking to understand when rules are formal or informal. So a formal rule is like a constitution, and the formal rules are quite fun because they're written down. Everybody should theoretically have access. We can all go and read the constitution and understand what our rights are. So we can hold someone to account for not working in that way. Whereas an informalized set of rules are a bit more like a mafia organization, right? You only understand the rules if you shake hands with the people who are in that club. And if you're not in that club, you don't understand how to enter, when you transgress, when you don't transgress. It's all about handshakes, and it's not written down, and it's not easy for people outside to monitor and say, hey, you've stepped out of line or you haven't stepped out of line. So when we're trying to change that, often for me with programming, we're trying to help groups move things slightly more formal. So we're always trying to formalize the rules of the game in order to make them more open, more transparent, more accessible to everyone. So that's what we were sort of looking to do in terms of our collaborative practice, right? Those were the rules of the game, were how people engaged around delivering health services. And so we were looking to strengthen collaborative practices among our partners, which included the private sector, civil society, the government. And we saw those practices as the scaffolding of mutual accountability. And so that's where we got our ladder. And the ladder is partly, we can go to the next slide. Oh, thank you. The ladder is partly about the scaffolding, but it does recognize that there are different ways in which to collaborate. And when we were talking with our partners and doing the research, people had very different definitions of collaboration, not just what it was actually, but ideas of what the pinnacle of the ladder was. And interestingly enough, for lots of people we worked with, information sharing, which is currently at the bottom of our ladder, was a pinnacle. We had interviews with the donors who were in a health partners group of all of the donors, USAID, FCDO, CEDA, JICA, everybody was there, and they didn't share information. When we interviewed them for this study, they talked about how amazing it was that POTENCIAR had been able to get some level of information sharing where we did, because even they didn't share information. And so more often than not, the Ministry of Health was working with less information than they needed to make decisions and to coordinate the donor groups. But before we go through our different rungs here, I did just want to emphasize that any ladder, in order to function, needs the struts on the side. You can only have rungs if you've got the 2 struts on the side. And our research showed us that the critical ones for that are communication. And of course, communication is essential to trust building, and therefore essential to maintaining relationships. So the 1 strut is always about internal communication, just within the small group that is health directors or your health clinic, or the department of the provincial department of health. That small group, it's communication in there. It's transparency within that group. And then, of course, as you move up the ladder, or you want to collaborate with others or engage with others, you've got to start engaging in external communication. That's always a little bit harder. So progressing upwards, it can be much more difficult because somebody speaks to the press when they shouldn't. You've been trying to broker a relationship between the Department of Health and a private sector provider, and the private sector provider does an interview about what they're doing, and suddenly the trust is dropped. So external communication is a truly difficult element of it, but these are the 2 things groups should be doing every day in order to maintain collaborative practices. Then, I always talk too long. Then as you look at it, so knowledge sharing is one of the first rungs, but I think it's important to remember that you could start with implementing a collective program, because like us, we were put in a consortium and we had to work with IDS and SESC and other people, and you're all supposed to be coordinatedly, collectively implementing, but suddenly you work out that maybe you didn't all start from the same understanding of what you were doing. So you step back and you come back to knowledge sharing, or you start there. It tends to be intra-sector in our framework. So this is about, health groups communicating with one another, health directors communicating with one another. But it is about how you get access to information, and how you understand where and how to get it, and how you share it with others. The next step or the next rung in the ladder, let's not call them steps because steps suggest going up, is participatory planning. Now, this is not necessarily about us all planning together to do one thing. It's about plan sharing. So we do come together in a room and we say, well, we're going to be doing this, you're going to be doing that. Okay, so we roughly know what everybody's doing. We minimize duplication of effort. We get a little bit of sort of resource efficiency. Then you can step up into coordination. Coordination means that you might actually adapt some of your planning based on the plan sharing that you're having. You're all trying to focus on the same objective, but it is intersectoral. It should continue to avoid duplication and increase efficiency. But then what you might do, and particularly in health this is relevant, is think, hang on a second, cholera outbreaks in Mozambique, which are fairly common, are not just a health sector issue. So now we need to step out of our space and try and bring other actors into the space. And again, when you do that, if you think about knowledge sharing or information, suddenly you've got to collectively try to understand the ways in which your different sectors and the different information you have should interact in order to deliver better health services. So these spaces are about collectively coming together, pooling evidence, analyzing and unpacking evidence together, and then problem solving on the basis of an agreed set of evidence that you're happy to take forward, and sort of setting a broader goal. Then you can move to collective implementation. But again, in collective implementation, you may not all be going for the same goal. So somebody's trying to solve cholera and WASH, somebody's trying to deliver better health services, somebody's doing communication of information about cholera. The sort of pinnacle of the whole thing is collective action, which is mutually accountable work together. So collective implementation, but where you're all striving for one outcome. I guess in a way it's like a program, like a development program, right? The outcome is up here, and each of you are going to be doing different things that are going to build to that outcome. And the outcome cannot be achieved if everyone doesn't do their bit, right? But you're not necessarily just implementing the same project. So there's much more communication involved. There's much more collaboration and adaptation. You have to be flexible and try and work with others. But you're also holding each other to account because you can't achieve the outcome if everybody doesn't play their part. So those were, we've got to go fast here. So that was our ladder. But then, of course, we were operating in this context. And the context was really, truly difficult, particularly for something like the health sector. So Mozambique is, you could broadly describe it as authoritarian. And it's a very centralized system of government. So at that macro level, there's strong centralization of decision-making and power in the president, but actually, depending on who the president is, the current one, the previous one wasn't very strong. So it was really in the party, this post-liberation one-party state, and with that strong Frelimo party. So things didn't happen unless Frelimo thought they should happen. And so if you were a bureaucrat down in the Provincial Department of Health, you never want to make a decision without somebody further up saying, yes, that's a thing you can do. Then they said they would decentralize health. So, or decentralize a range of services. So it was decentralized, but what they did was establish two different parallel systems for managing the health service. So in the end, what we get is a whole range of power asymmetries of centralization, but also this, one of my favorite terms, particularly when you're looking at governance, which is fragmentation. Two different systems that are making decisions about the same thing, but are staffed differently, report into different areas, and often don't talk to one another, or just don't talk to one another because they're in competition. And then it becomes very difficult to get things done or to drive systemic change, which is a change in the rules of the game that actually flows right through from local from local to center, and will hold on, will stay fixed and not necessarily change. So fragmentation is a particularly significant problem in Mozambique and in the health sector. You can see on the slide there are other elements. So what's interesting, I think, is that in fragile and conflict-affected spaces, enablers and disablers are often just two sides of the same coin, right? You know, we've got leadership there. So you could have leadership that decides to step out and think differently to the central leadership. Or you have the central leader that everybody has to listen to. You can think about resourcing. So there is resource scarcity in Mozambique, particularly in the health sector. But then so resource scarcity is one thing that tends to work away from collaborative exercises, except actually then, and that's of course why we were working there, at the subnational level, where suddenly, you know, health services are just not being delivered. And if you run a health center, all you do every day is not deliver everything. And the people who come to your health center are not having a great time and aren't particularly pleased with you, tend to stop coming to your health center. Your staff are not very motivated. It's this horrible cyclical downward cycle. But actually, probably, as we learned, you go home every day and you think, I wouldn't mind doing my job a bit better than I currently am able to do it. And so what we saw happen at the provincial level in particular was this sense of, you know, the center doesn't actually care about whether we deliver health services. So maybe it's okay that we try and do this differently and see if we can actually deliver health services, because it gives us validation as individuals. And so as bureaucrats in the system, we're going to take a shot on this collaboration that this program is offering us money to do, and that's always helpful. You get a lot of power from having some money, and you can bring people into the room. Then, of course, we had to say to them, look, we don't have so much money. So we're here to try and model ways in which you can work together to get resource efficiency. And if you actually do something well, you might be able to leverage that private sector company in your district to pay for something else. And so we had to try and model the ways in which resource scarcity, well, not resource scarcity, but model the ways in which collaboration could adjust resource scarcity. And so we'd fund things like aid training, but you'll hear now in the case studies about how that then can be replicated even without the resources. And I think a really interesting point about that, and then I will pass on to Cecilia, is that we often talk about issue-based programming. You may have read about it or studied it as an approach to governance programming that fits in this flexible, adaptive, problem-driven, iterative adaptation, all of these terms that we talk about. When you go down to the local level, and you're talking about whether women who give birth are asked to make payments in order to do that, payments that they shouldn't have to make. Actually, if you talk about that issue, everybody can get on board. Even a health center director probably has a wife or a daughter who's had to do this. So suddenly, because it's an issue that everybody cares about, you can bring people together without a whole bunch of resources to try and figure out how to solve it. And so sometimes that resource scarcity allows for the innovation or the space for people to say, well, we've got to figure this out somehow, and maybe this is a model that could work for us. So I'm going to stop there and hand over to Cecilia to give you some actual practical examples of what we found and what we think we're learning.
Yes, you can move to the other one, because now we're just connecting everything that was talked about with the case studies. So the first case study is knowledge sharing. So remember our letter, the beginning of it? Yes, knowledge sharing. So the case study is about the exchange visits that happen within health units. So we had a context in Mozambique, in Nampula, in which no humanization training happened for service providers, but then you ask me, what is humanization, right? So we had a context in which we have a health unit that doesn't hear the demands, doesn't listen to the patients, doesn't listen to the demands, their needs, or if it listens, doesn't care and have empathy with it. So, but why? Well, lack of resources, lack of training, a lot of things. So then we said, let's train the service providers on humanization. But again, lack of resources, as we said, so we can't train everyone. And then we trained some health units, some directors, and then these directors replicated this training, which led to the exchange visits. So then we implemented the directors who received the training. They organized a group of 15, 20 people, and they went to other health units, talked with patients in that health units, talked with technicians, and talked with the team, so the team could develop a action plan. So how to improve the services in that health unit. This led to after the meeting, a WhatsApp group being created, and this information sharing keep going even after that. So then we have 2 moments of information sharing. The first one in which, yes, we learned about it. We learned about how to do, we learned about that, and let's share with you. And the second one, which was, let's keep this conversation going. Let's see if new problems will keep happening, and let's deal with it together, which was in the WhatsApp group. So then we have, that's everything that I said now. There are a lot of enablers and disablers. The enabler of it is scalable resourcing. So because, yeah, we didn't have money. It doesn't matter in this case. We did the most with what we had, and then we improved, incentivized other directors who received the training to train others. We improved relationships, we improved trust by saying, okay, we keep the information sharing here in the WhatsApp group, we can share our problems, we help each other out. Again, social media, so technology being used for that. And there was different incentives, so financial and professional incentives, as Karin said before, like people want at the end to live a good job. They want to, so this is a professional incentives. And then this leads to, okay, so how can we do that despite of our problems, despite of our lack of resources? So this led to innovation. And when we think about disablers, we've talked about that, about the resource scarcity, about the social norms. Social norms meaning that as the service delivery in Mozambique being quite poor, means the expectation is low. And when expectation is low, oh, anything that I do is going to be fine. So this could be a disabler, because no, it's not anything that I do that will be fine. We need to improve our service. And the power asymmetry, so it's much easier, of course, to share information horizontally, to learn horizontally than for thinking about top-down, mainly in a context in which we're talking about a very authoritarian, about competition, as Karin mentioned before. So if I'm competing with you for resources, I'm not going to share this information with you. So this could be a disabler. But when we put them together and the relationships are working, then we can minimize this disabler. Next one. We had also the Holistic Vision Conference, which is another rung of our letter, a little bit up there, in which we had these conferences. They always happen in the health sector, but it was just a conference from the health sector to present, not to share knowledge, basically, to share the information sharing only. But that was it. The difference was that now we had an Holistic Vision Conference. It was not just one conference, it was a conference in which you said, wait, let's put the private sector here. let's put the civil society here. Let's actually talk, discuss collectively about these issues, because problems in health are not only about health. People who give services to the health sector, sometimes is the private sector. It's the private sector, and then we have different actors that are important for that. So then we had a conference in which we had to deal with lack of money again, which is always a problem. And one thing that is very different in the approach is, okay, actors got together to deal and get multiple sources of funding. So usually it's one source of funding, you go, you do the conference. In this case, the conference wouldn't happen. So POTENCIAR entered and said, okay, why don't we do this? Why don't we involve the private sector? Why don't we bring it together to be involved not only as part of the day, but also financially? And then that was one different way of doing. Also, the conference was planned together. So the POTENCIAR was involved, another units and other organizations were involved in the planning, the structuring of the conference as well. So again, when we talk about enablers and disablers, we have a shared identity. This was created together. We have relationships and trust building, and we have a leadership that was interested in sharing, in working together to develop that conference. Next one, because my time is... And then lastly, this is on the national level, we're going to talk about the legislative process for addressing obstetric violence. So obstetric violence is a big problem in Mozambique, and there was no law present there to penalize this practice, basically. So the difference is now there is a law that was proposed, hasn't been approved yet, is to be approved by the next government, which is next year. But the important thing about this one here is this law was drafted together with civil society and with the government itself, with parliamentary committees. So we had workshops in 3 different areas of the country, with many people saying, look, this is important to have in the law, this is important to address. And after the law was proposed, from these workshops, a draft was created, and this draft was then given to the parliamentary committees, so they could say, this can be, this cannot. So they were involved in the process. And this will make it easier for the law to be approved, hopefully next year. So, and this just to finish, that one disabler, the fragmentation, because currently, as we've heard here, we have political instability. And we don't know, changes in parliament, so this might delay the approval of the law, but it's that. And now I'm gonna pass over to Karin again, so she can put all of this together in what we call the development game.
Thanks, Cecilia, and do it in 2 seconds. So anybody none of you have ever heard me speak about political economy, but if you ever hear me again, I love a game. So I normally explain political economy using football or soccer, because it contains a lot of the elements of what we're actually looking at. And so the idea of snakes and ladders is a way to provide insight into the dynamics of the political economy of collaboration, right? We're players. We're a program that's a player. The people we're working with are players. So we've got a board. And the board, if you've bought snakes and ladders, you've got a board, right? It's not going to change much. Mozambique is a country that has an ocean, it has some natural gas. These are things that can't change, right? We understand that about Mozambique. It's got a political history. That means there are a couple of snakes. One of the largest ones might be Frelimo, but I shouldn't say that out loud per se. So there are elements about the game that we can't change, right? There are also some donors. There are occasionally a snake, sometimes a ladder, depends who you are. You've got to throw a dice. So there's a moment where you've got to step into the action. You can't throw your dice all the time. Everybody gets a turn. There are rules to how you play snakes and ladders. And we loved it because it had this thing of, right, snake election. You've got so far, and then there's election. The whole country breaks down. The economy falls apart. You can't do much. And as a development program, you're trying to move forward. And suddenly you have to stop and take several paces backwards. So it captures the complexity of the context. And we like snakes and ladders because there is a bit of chance to it, right? It's just that they are contextual factors that you as actors, that civil society groups don't always have control over. So it's important to have them there. But we saw our role as a program in this brokering and convening approach was to help civil society and other groups and government bureaucrats construct their own ladders. And the lovely thing about constructing a ladder, if you can change the rules of the game that are happening, is it can't, it's there. Sometimes you may not be able to dice your way back to it, but eventually you may get back to it. And it's an artifact that's there. So it was about us allowing people to build their own ladders to navigate the snakes. And one of the ways we saw them as being able to do that was through collaboration, through information sharing, through greater transparency with one another, and then externally. And in that way, making what they were doing visible to the population, making themselves accountable to that population, and setting up structural rules that might persist beyond our program. Of course, sometimes ladders are made of poor wood, or there's a little too much weight that gets put on the ladder and it doesn't always hold. But at the very least, maybe the struts remain and you can go back and start creating the rungs in the middle. So it sort of, for me, captures the political economy and what collaborative practices can allow groups to do within that. Do you want me to talk about debate?
Sum up where we think this might be.
Yeah, okay, so very, sorry, Neil, he's going to be way more interesting than me. I think what's interesting in terms of our relevance to the wider context is that there are a couple of things. One is asking the question of all of us in the room and of ourselves, is this ladder of collaboration a useful way to think about thinking and working politically approaches and adaptive management approaches? I think one of the things we may be showing is that there's value in incremental change. And I don't think that's something we don't know, but that in certain contexts, incremental change might be all you can get, and you do need to celebrate the small step ladders you make just by information sharing, and not always just keep looking for the better outcome. I think one thing that is worth discussing, because there are then broader lessons, is how exceptional is Mozambique given our current global context? I think we often tend to think about my continent as a little bit, we're the disaster zone in Africa of things. We're always lower development countries. We're always having the coups. Maybe that's just how it feels when you live in Africa. But actually, we're not that unusual. So this closing civic space in particular, if you think about America on January 6th, right? This is happening all over the globe. So is Mozambique that unusual? One of the things that was slightly unusual, though, I have to say, is we were in Nampula. So we were restricted quite nicely. And that's another set of lessons potentially for donors like FCDO. We were restricted to Nampula and we were restricted to health. And Nampula is like it's the development playground of Mozambique, right? If you want to pilot something, you pilot it in Nampula. So not only were we working on health, there were 20 other aid programs all trying to do something on health. Wasn't a spectacular amount of coordination between us, but it was growing by the end. So in that way, our context was quite unique. But I think maybe for me, the more interesting ones are about these adaptive programs and adaptive management and thinking and working politically, and whether or not we're learning things about, so adaptive management often talks about fail fast, which is really nice to say, and the donors hate it, and people in context find it really difficult. I mean, certainly on my continent, we've learned, we had very British schooling systems, so you've learned that you need to get 100%, and 95% is not that good, right? So you don't talk about failure. African culture does not talk about failure. Dad or grandpa, top of the list. They never do anything wrong. Your central leader never does anything wrong. Talking about failure is not part of the DNA. And actually, in development programming, it can be a real problem because you start out going, okay, well, we're going to try health. We're going to do a little bit of something over here. We're going to try WASH. Well, WASH is too closely linked. We're going to do citizen participation. Or in Bangladesh, I was doing chickens, healthy chickens, fairer migration, and climate finance. Healthy chickens was really jolly hard because it interacted with big pharma. So then I was like, team, feasible, not feasible. This is not feasible. We need to move out of this space. But the team had invested their social capital in relationships and research and building of a network in healthy chicken space. And then we were just going to drop it. So we had the advantage of staying in health and in Nampula, which then meant that a lot of our relationships we could build on, and fail fast doesn't allow for, or makes that very difficult. I'll stop there because there are other things we can chat about, but.
Yes, to be continued in the Q&A. Thank you, Karen. Thank you, all presenters. And Neil, we were going to give you 10 minutes. Can you do it in 5? Over to you. Thank you.
So I'm just wondering, Alex, whether I know you have a break at 2, and there may be some burning questions out there that somebody who needs to leave at 2 wants to ask. So, well, I was just wondering whether you wanted to have some quick blast of questions first, and then I'll do my discussing comments after,
We can see if
as you wish.
wants to jump in. Do we have online questions, Karen?
Not at the moment.
No. Is anyone in the room unable to stay till about 2:10 or 2:15 to hear from Neil as well as the panel? You need to go. So would you like to make a comment or a question?
Yeah,
Okay.
I'll make it short.
Yeah.
Thank you for the sharing. My name is Kash. I'm from Taiwan, and I'm pretty curious about, in practice, how do we ensure that different parties with different stakeholders and with different priority and perhaps different goals can efficiently collaborate together? Because this is kind of a fundamental assumption of today's sharing. So is there a case that we will exclude someone, we should exclude someone, and then set maybe a standard for people to join in the very beginning? This is my first question. And the second question, actually, in practice, how do you balance between decentralized, giving everyone the space to talk, to share, to collaborate? How do you balance that and efficiency? So yeah, those are my questions. Thank you.
Great questions. Really easy to answer in 30 seconds. I think you have to leave it too. Okay, okay. So I think I'll ask if someone, probably just one person from the group, wants to comment quickly, and then we'll go to Neil on the decentralization, transaction costs versus efficiency, getting things done, and is it sometimes better to exclude people in order to get trust and collaboration going?
Do you want to go? Okay, so very quickly, they are very challenging questions. I do think, often in collective, when people talk about collective action, I had the good fortune to work with a man called Simon Foote, who sort of had a lot of thoughts about PEA in particular and thinking of working politically. And I think his big point was actually you don't always have to have everyone in the room. Collective action doesn't require everybody sitting around a table. Sometimes the brokering and convening role that we're supposed to play is that we might sit with government and work out what's happening and then communicate it to someone else. So I think there is great space for bilateral, individual conversations. Do not assume the collective, if you're going to drive an agenda, that everybody should always be in the same space. It is very difficult. You get confrontation, all of those things, and you can cleverly work around it. So I don't think it means everybody must always be in the same space, which does help the efficiency question you ask about those moments. I mean, I think it's it's one of those challenges, right? And if you're in a development program that doesn't have a lot of budget, the time it does take to develop those relationships and have everybody share in a space is really difficult. And you just have to give the process time and sort of hope that through illustrating one process, it slowly gets, more and more easier and easier for people, that people will engage in processes where, maybe one women's group will step into the space to talk about access to documentation, and they will have canvassed. So you can have different spaces in which to then give somebody voice and voice with evidence. And then only one person has to be in the room, but they are speaking on behalf of others. But you've got to be very careful about how that happens.
Thank you. Does that start to answer your great questions? There's a lot more to say, but thank you. But thank you for starting the discussion. Great. So I think we'll go to Neil now, hear your reflections, perhaps on that question, as well as on what you've heard from the presenters, and then we'll open it up for a second round.
Yes, it's a great question. And actually, your question was one of the points that I was wanting to make. So thank you very much for asking it. I mean, first of all, it's great to be back. It's lovely to be back in IDS and back with old friends. And thank you very much for inviting me. Let me tell you what I really like about this program. As you said in your very generous introduction at the beginning, the policy practice focuses on political economy analysis and thinking working politically. That's what we do. And I heard lots of echoes of the theories and concepts which we teach in the political economy courses that we run, which I'm sure you'll all be very familiar with. This program thinks, it very clearly does PEA on a regular basis. It looks at the context, it scans the landscape, it tries to understand what's going on. It sounds like a bit of a no-brainer, particularly in IDS, to say that, but actually that's remarkably unusual. There are an awful lot of programs who've got a solution in mind, and they come with a solution, and then look how they can apply that to pretty much every problem. I remember rather infamously recently being told, what political economy analysis can we do for this blended finance instrument that we're going to use? Because we're going to use blended finance to solve this problem, whatever the mechanism, whatever you decide. So it's great to see it thinking. And I also love the fact that it adapts, it shifts, it moves itself around. It is wonderful. And I think DFID and now FCDO deserve a lot of credit for being a leader in designing programs and that actually allow you to shift things around as you go along. An awful lot of programs don't do that. And sadly, fewer and fewer FCDO programs do that these days. And it's really important because stuff changes. I really liked your last slide where you say it's about relationships, relationships, relationships. It's all about relationships. Ultimately, it's people and organizations that change. Therefore, if you're really driving change, you have to, figure out who wants to do what. And I particularly like your point that was made by several of the presenters about people want stuff to work. We tend to sort of assume oppositional relationships. Often those oppositional relationships aren't built in, aren't baked in. When you're running a health center with no resources and people are really unhappy with you and so forth, then you go home at night and feeling a bit miserable about the kind of job that you do. And you're frustrated, and that frustration may come out in the way in which you behave. But very often, if you are getting people together in the room through a suitably brokered conversation, you can make a lot of progress because people actually want to do a better job. So I love the fact that your program is very much focused on this collaborative element where you're assuming positive outcomes actually are desired because they genuinely are desired by an awful lot of people. That said, one of the critiques I was going to make was the point which the gentleman in the audience made, which is that there are interests at play. And I didn't hear an awful lot of discussion about what those interests are at play. Possibly you don't want to talk about them, but not everybody is on the same page. And sometimes people are on opposite pages from one another. And that then gets to the question of who you want to invite in the room. You don't necessarily always want to invite everybody in the room. And it's not just because of the representational issue. It's because some people are actually working against what you're trying to do. I particularly like the fact that it's multi-level. This I've seen in several programs in different parts of the world. If you do a community level participatory type of thing, then you'll have fantastic experience at the local community participatory level, and then the program will finish and everyone said that was lovely. And how does that get embedded in a sustainable transformation? It only really happens when you're doing it at the next level up and at the next level up. So the fact that you're trying to work across levels, I think is really good. And I love your empower, collaborate, and influence framework. I think, I hate to say it, but in 10 years' time, when people look at POTENCIAR, they will have this little Venn diagram. Every single one of these programs I've ever seen is a beautiful little Venn diagram with 3 something or others all intersecting, and it's always empower, collaborate, influence. I mean, these are the stock of this kind of way of operation, but it's a very nice framework, and it deserves to, basically, we're going to steal it. So expect it to pop up in. I'm not quite so sure of your snakes and ladders analogy. I love the snakes and ladders analogy. I think it's great. I'm not quite sure how it fits in with the little Venn diagrams. The key question on that one, though, is what's the strategy with regard to the snakes? Some of these snakes, by snakes, you were talking really about aspects of context and how those aspects of context which you cannot influence and which may hit you need to be navigated. I think that's very important. Snakes can also be actors. There are real snakes out there, as we know, and life is often about trying to avoid the snakes, but sometimes you can't avoid the snakes, so can you kill the snake? To what extent is there is the coalition building, which is pushing against people who are trying to push things in the wrong direction? Or to what extent can you provide yourself with a little bit of resilience against the potential shocks, the snakes that you might slide down? We all know when we've played snakes and ladders that You don't mind if you slide down the one that just takes you 3 paces back, but you really care the one just before the end, which takes you right back to the beginning. You want to avoid that one. So how can you build in systems that can avoid the worst damage, even if you know that some damage is going to get caused? You're going to slide down some snake at some point. And how do you pick yourself up afterwards as well? And it can be very demoralizing. So how does a program build in mechanisms where it says, listen, this stuff is going to happen? I thought it was very interesting. You didn't, Ludo talked a little bit about it, talked about the budget cuts. The budget cuts from FCDO, we all know, were utterly brutal. I believe you had 70%. One program I was working with had a 90% budget cut. And these were, I mean, this was, as Claire Short recently described it, just sheer vandalism, and that it was. But one of the very few bright lights that came out of it is that there was a much bigger focus on brokering and convening because there wasn't money to do anything else. And actually, I think brokering and convening is exactly the right kind of approach. At the end of the day, if you've got lots of money to slosh around, sometimes it can facilitate and it can certainly help make things happen in the short run. But this stuff has to get funded by the state. And therefore, embedding that into government, into budget processes is exactly the right way to do it. Because at the end of the day, there's only a certain amount of passing off to other donors to be able to continue programs one can do. You want this to be an integral part of the way in which the health system operates in Mozambique. So that brokering and convening approach, I very much like. If those of you who don't know it, there's a wonderful chap called Jaime Faustino in the Philippines who works for the Asia Foundation there. He's written, along with several others, books called Coalitions for Change in the Philippines, amongst others. And I loved his description of how to make change happen. I said, how do you do this stuff, Jaime? And he said, it's very easy. You get the 5 people in the country who really, really want to make this change happen, but who have different skill sets, and you bring them together and you pay for the tea. And it's that brokering and convening role, which I think is absolutely critical. You know, there are lots of people who have different powers, different scopes of influence, different skill sets, and bringing them together and helping them to figure out and supporting them to figure out how to make the change happen is far more effective, I think, than external programs coming in and implementing stuff. Okay, now I've got not critiques, but I've got a bunch of questions. And perhaps we can mix those with all of your questions. First of all, we talked about how to think and work politically in a conflict environment, in an authoritarian environment, and a closing civic space environment. You didn't actually describe how that affects the program very much and how the program has adjusted that. I'd be very interested because, as you say, this is happening in rather too many places. Secondly, I'd love to know, I know we've got Kathy here, so maybe you can speak to it, what's actually been achieved? A lot of these participatory programs deliberately try and measure the extent of collaboration, how well people are talking to one another. You gave some brilliant examples in the case studies of how that's happening, and I'm sure you've measured that. Are health outcomes any better? You know, it's actually very important, I think, particularly in an IDS type of context where we love this sort of great big group hug. You know, yes, we're now all talking to one another, this is wonderful, but has it actually made healthcare better? Because that is what people care about as well as participation in the process. I thought the focus on grievance redress mechanisms is a very interesting one. And this is a controversial statement. I don't know the research in this area. I should have prefaced this by saying I know very little about Mozambique and very little about health, so I don't know why you invited me. But anyway, the grievance redress mechanisms are critical as ways of having interface between the users, if you like, of services and the providers of those services. I'd love to know the evidence about whether GRMs and the focus on GRMs is the best way of getting better service delivery. Because actually, a large part of your program is about collaborative arrangements between service providers and getting them to learn from one another, which isn't really about GRMs. So I'd just be interested to know why that was the area of focus. And then one final point, we talked a lot about politics. But actually, this was a relatively politically neutral program almost. All of your politics was small p. But of course, anybody who watches the news, even I don't know much about Mozambique, know there's quite a lot of big P politics going on. Ever since the election, people are rather unhappy with the way in which things have panned out. And indeed, a very large part of the 2023-24 strategy, I understand, was about trying to influence the political campaigning, getting things onto people's agenda so that you could follow through with actions plans. I'd love to know how that went. Quite often with these sectoral things, they don't have resonance politically. Unless they become a political flashpoint, they just get dropped because there's some big campaign item which dominates everything, and then everything else. I can't tell you the number of times I've tried to sort of write to your MP to get development onto the agenda in a UK election. Waste of time. They're never interested. I don't know what the key issues were in the Mozambique election, but I doubt it was maternal and child health care in northern Mozambique. So what do you do in that situation? How do you make this political? Because it has to be political in order to get the resources to be able to make it sustainable. I'll stop there. Thanks.
Thank you so much, Neil. So I think you asked the question, why did we invite you? I think you've just answered that question with a brilliant set of reflections and challenges and comments. Couldn't have asked for a better discussant. Thank you. I think I'm going to ask everyone to hold their responses to that while we just open it up and see if anyone else in the room or online would like to add any questions in the mix. And then we'll come back to Ludo, Karin and Cecilia to... There is a question online? Oh, it's on the email. Okay, great. Unless you just want to read it out, go ahead. Okay. I haven't got your email, Gary, so can we ask you to read the one that's online? Oh, we do have one in the room. Sorry. Please go for it. Thank you. Yes.
Hi, yeah, I'm Boris. I'm a student at the university. I wanted to ask about this. So Nampula is this development playground. And you're saying how there's loads of different development orgs in the room, in the space. And I was just wondering how that impacted your, I mean, I assume that means that there's a certain type of relationship that local people are expecting with organizations. And so there's a question for me about how did that, like what differences were there working there compared to implementing in other places in Mozambique?
Yeah, Gary, I've got Charles's question now.
Okay, yeah.
To read that.
Yeah.
Okay. So yeah, from online, Charles Cadwell's got an interesting question stroke challenge. So pointing out the localization rhetoric calls for deferring to local views, local leadership. But the latter activities are hand-on and externally prompted forms of collaboration. So some of us have asserted that localization requires political economy insights to be effective. But how do we operationalize choices about who we empower by working with them? So I guess it's the opposite of the who do we keep out of the room, is how do we justify the choices we make about who do we bring into the room? So how have you adapted your approach to the localized and decolonized pressures, which don't take much account of details? In Mozambique, were there local leaders in your overall strategy and choices? So I think, Ludo, you might want to speak to the Provincial Director of Health there, perhaps, and reflect on that, or Cecilia from that case study of the holistic vision as well. Great. So do we have any other questions in the room? Okay, brilliant. I might abuse the chair's privilege and speak about Nampula a bit, because I've worked there for quite a long time. And it is really interesting, the regional contrast in Mozambique. But I think I'll come to your question, Boris, at the end. I'll invite the panel to reflect then on Charles's question about the role of local leadership, and is this actually how decolonized is this, and or should it be? With regard to localization and local leadership, and then Neil's points, whether that's on GRMs, is that the right entry point for a collaborative program, right? On I think the big snake, right? Are we on a snake that takes us off the board completely? Because those of you who follow the news would have seen that since the extremely should we say flawed electoral process in October, very large numbers of Mozambique citizens in an unprecedentedly cross-country way, so right across the country, citizen groups have been protesting, cross-class, cross-country, a lot of women's leadership. Our colleague Katja Taylor, who's online, has been doing some fascinating research on women's leadership with these protests. So does this mean Mozambique is at a point where actually, you know, the snake's moved us to a different board? Or Ludo, particularly as you're on the ground. In fact, if you can hear us with the banging of pots and pans outside your window from the protests, it'd be good to hear your thoughts. And the rest of colleagues from the PMU, I'm not sure if any of them are online, but the colleagues that you're working with in the Programme Management Unit in Maputo, what are your conversations about any of this? Will the obstetric violence bill stay on the table in the Assembly, depending on what happens? Who are you talking to? What's your hope that some of this will be durably institutionalized in Nampula, but at the national level, crucially, given the political context? And Kathy, perhaps we could bring you in to talk about evidence on achievements. Kathy's shaking her head. We think there is some, and in fact, Kathy,
there's definitely not.
we're not measuring potential health outcomes. We should say that, but Kathy can talk a little bit more about that. So I think I'll perhaps just go round. Do you want to go first?
No.
Ludo go first. So we'll follow the order of presenters. Yeah. So Ludo, Karin, Cecilia, and then we'll jump to Kathy. Yeah.
I think we'll talk as well about the conference because.
Yeah, but feel free to share insights from the case studies that speak to Neil's questions as well. Yeah. Ludo.
Yeah, I'll try to address the question about sort of the selection of where the program was implemented, in part, in a sort of a conflict, fragile environment, and secondly, in a competitive environment. In this development playground, it was initially selected. We intentionally avoided Cabo Delgado initially because we thought that this would be difficult to implement a governance approach when there would be, it's a humanitarian setting. There's an emergency response ongoing. And that makes it very difficult for trust building, the approaches that we were trying to experiment with. So the selection was for Nampula, which was bordering but not directly impacted by the conflict at the time. Over the course of the program, however, the conflict did sort of head south and eventually entered a bit the program locations. So we've had to adapt our programming to the situation. It didn't affect the bulk of the programming locations, but there was some sort of pilots and studies that we were doing that were influenced. I think it's challenging. We had to work a lot with civil society and local leaders, and it's very difficult to measure the effects of how the conflict may have impacted. But feel that we tried to manage and took a conflict sensitive approach to programming. In terms of working within a competitive environment, there was a lot of different programs being implemented in Nampula. However, there were very few programs doing what we were doing, fortunately. So that made it a little bit more possible to hopefully measure the impact or the results that we were having on our interventions. There's a lot of investment in health, but not so much of a focus on humanization, governance, on HR practices, on the ethics of health curricula. So the innovative approach that we took allowed us to sort of differentiate our programming from other organizations in this sector. And I will speak also to the GRMs versus collaboration. The GRM focus was a bit more of a confrontational approach than the collaboration processes that we were trying to implement. However, we worked a lot with government actors and to sort of raise awareness about the importance of GRMs and the value of GRMs. And so I think that over the course of the program, we hopefully change a little bit the perspectives of what, how GRMs can sort of contribute towards better health outcomes and sort of have a collective vision of how they can help, or how people should not perhaps be so defensive, so protective about complaints. I will say that we had mixed results in some case, and often our monitoring team, and actually our monitoring team can speak about it, identified cases where health facilities were very proud to say we have had no complaints anymore, so everything's going very well. So it's still work in progress, but I feel that we have made some changes. Thank you.
Karin.
I decide which one. I might engage on the politics and the politically neutral. I mean, I think I have two reflections on it. One is that I often find myself in programs taking quite a bit of time with people because of this issue of relationships, to say that that small p politics is equally important at the subnational level. Yeah, I hear you on the resourcing, but that sense of you really do have to understand who the local councillor is, what they're interested in. Are they going to influence the decisions around which teachers can be put in position in Tanzania? And it's often a way to liberate national staff to feel like they can have these political power conversations because they have them at the small p level of relationships and those dynamics in the context in which they're working. So I'm a fan of the small p, but I think that the big P politics has been a real challenge for us. I mean, I won't speak to the election manifesto work because Ludo is probably better at doing that. I think we've maybe been a little conservative in our approach to that. So, I think we've always struggled with getting ourselves back to the national level. So we had the huge advocacy campaign, and Humanismos, I think, has been successful and has actually elevated obstetric violence in the national agenda. And so we were able to get traction on the law. Some of that has happened, or whether it would have any impact on health budgeting, I think is a very separate question. So some of those, so some of the big snakes, I think, have been a challenge. I mean, I think for me too, and we've got to write it well and think about it more. Those big individual snakes, it all comes down to, how people are mapping who they're working with and who they need in their spaces. And we have done quite a lot of work at that. I think I sort of didn't really talk about it, but I think it's been one of our bigger contributions is supporting people to map better and to start by looking at interests and incentives in order to figure out who might come on board with them. We haven't had to avoid too many people, but it definitely sort of who might come on board and who might be reasonably neutral, but with power, who we could convince to come on board. So I think we've done a bit better at that in terms of supporting groups to map stakeholders and map their incentives. So power mapping, not just stakeholder mapping. And I think we have had some successes there, but I take the note on working through the analogy and making sure we're speaking to how different things get addressed. But I do think partly for me, it's about the sense that maybe because you're working with the program and thinking collaboratively, you've got an extra set of ladders that aren't on the board that you get to put on the board to get over certain snakes. So it's not just that you can climb a ladder that's there, but actually collaboration gives you a whole bunch of other ladders that might forge new paths on the board. But we need to talk about it better.
Celia, do you want to think about the DPS and the role of local leadership and any other points that came up that you think is...
I think I will talk about the conference, yes, the role of DPS there, but how the relationship of DPS with POTENCIAR and with UCODIN, which were organizing the conference as well, had its problems because we're talking about relationships. right? And like, yeah, everything is about relationship. And communication, which is our struts, right, on both sides, affects the relationships. So, yeah, so we had the conference and everything, and nice, happened, never had a conference so big like that nationally in Mozambique, so it was a success. But on the back, we also had the head of UCODIN, which was organizing the conference, not being invited to the conference. Why? Well, problems that happened in there. We also had problems of communication between POTENCIAR and DPS just because of disagreements on how the conference should happen, which is normal, but how to deal with that, how to communicate that in a way that is not going to affect the relationships, because you do need these relationships to keep going. So yeah, I think that's my point.
So was the director of UCODIN a snake? We're not going to answer that question, but we're going to ask Kathy. We're going to ask Kathy to comment briefly on how we go about evidencing change, given that we're not measuring outcomes in terms of maternal mortality.
This is where you're going to regret giving me the microphone. I mean, I think there's lots of, it was fascinating going back to the business case, actually, this was posted as a 2 million a year program, I think, initially, which included another pillar we haven't talked about. And that was before the budget reduction. And you've got a pretty large consortium. And I think looking at the political economy of consortia and the value add, I've done some work recently with TPI where they've got some sort of frameworks to try and look at, what is the added value of working through consortia versus different structures would be very interesting to look at. I think in this case, we had a very overambitious MEL framework. It was modelled on Pearl, the programme. So we'd got Wilf's very sort of sexy log frame with adaptive indicators and what have you. This was a much smaller programme in a very different context. And through the various changes along the way, just performing political accountability in terms of log frames, value for money indicators, took a huge amount of effort and energy. I was quite bullshy from the start. We were very clear there was no way the log frame we were going to influence Mo Ibrahim indexes and all sorts of stuff, of saying this is nonsense. We're not going to do that, even when the budget was full. All we would be trying to do is really look at some of the immediate activities and what they were doing on a much more ad hoc basis. So there was using, again, the Pearl approach, looking at a kind of significant change. What are the changes that are emerging, and then drilling down and trying to understand how and why those happening. What's the evidence that you contributed to them in a sector where there's lots of other actors going on? And having said that, initially we didn't decide on the health sector till quite late on. But the one thing we did have was a decent budget for a midterm evaluation, and that was really, really useful because Michael Drinkwater, some people, what was the name of the company, that are very much based in Mozambique, knew the context really well, looked at my value for money framework, copied from Pearl, and said, you ain't going to influence anybody in allocations. So why have you got that as a cost effectiveness indicator kind of thing? But they asked us to reframe the program quite a lot, so we always assumed that their input, they would actually be the ones that generated some solid evidence, much better than our MEL approach with the PMU. I think there are about, how many people work in the PMU? 5, 6, 7. I mean, it's tiny. And, some with more experience than others. So what we could achieve was very limited. But the value of getting it was meant to be the final evaluation, but we got it for midterm to really evidence where are we going and to get them to challenge us and say, what are you going to focus on? We were planning to do all sorts of things. And they said, no, you can't go into social protection. You can't do this. But we'd already been pushed because our log frame indicators were to do something like 5 different pro-accountability initiatives, which were working on different issues. And luckily they said, even though we were getting pushed from FCDO to do a bit more, no, focus, this is what, be realistic, what can you do? So I think, the evidence there, but I think that speaking to the broader question, because I've done quite a lot of work with Pearl on value for money over the last 3 or 4 years, and they've just had a very interesting PMEL look at what's the value added of a thinking and working politically approach. I still think in those programs that are trying to influence governance change, finding ways to actually measure your contribution rather than assume some correlation of something changing going on is due to you is really, really difficult. So I think, you know, evidencing the more immediate outcomes, how and why do our strategies work at this collaboration or not? Are we actually seeing actors change behaviours, which makes us think there is a plausible contribution to something we're seeing on an indicator is probably the way to go. Having said that, Ludo's tried to do some rigorous impact evaluations of initiatives like this health director training of trainers, which they did on their own back. So it was trying to use ad hoc amounts of money to focus in on, okay, we've sparked some kind of change. Can we at least impact that's going on? And we're yet to see the results. But I think I suspect the actual contracting of doing that's been a challenge in its own right. But I think it's a really good question of how would you, even in an ideal world with lots of money in a place like Nampula, all these people doing something, what would be a sensible way to try and assess whether all these people in the playground are actually impacting women's, you know, births, you know, for mortality.
Thank you, Kathy. So we are, yes, so I think that's our next seminar. The findings from the impact study. So that's a good place to, so yeah, this is work in progress. The paper itself will be out hopefully by March, which is when the program ends. And then we'll hope to have further engagements around what we've learned, particularly around these impact assessments and learning things. Boris, I'm aware we didn't come to discuss Nampula. I could talk, we are 3 minutes over time. So if everyone can stay for another 30 minutes, I can talk about differences between Gaza province, Nampula province, Zambezi. But I think this development playground signifier is really interesting in a context where deviating from any kind of top-down line is extremely politically dangerous. Nampula has a kind of license to be a bit different, which other provinces don't have. Whether you're talking Gaza, which is pretty more heartland, hyper-controlled, or somewhere like Zambezi, which is stigmatized an opposition province where everything is viewed with suspicion. Nampula occupies a kind of middle ground where you're allowed to innovate a bit. The question then is how easy is it to transfer to either what Frelimo considers its heartland in Gaza or considers an opposition stronghold like Zambezi. I think there's a really interesting set of questions around which snakes, which ladders when you move from province to province, which we proposed doing for the 2-year extension. They didn't give us 2 years, they gave us 1 year. That's why we're finalizing the program. Maybe the following program will be able to, as and when it happens, we'll be able to investigate a bit more how those specificities of the snakes and ladders of the subnational level can help us strategize for successful collaborative working. But I think we did a reasonable job of putting some stuff out there, and it was very, very helpful to have these questions and reflections at this stage. As I say, we've got another couple of months to finish the paper. Thank you so much, Neil, for coming down and really stimulating.
Thank you all for listening.
Thank you very much, Gary, for making it possible.
Yes,
Thanks everyone who joined online and everyone in the room. And please join me in congratulating the speakers. Thanks very much.